Imagine a medical emergency where every single minute can make a profound difference in someone's life, shaping their future and ability to move, speak, or even think clearly. When it comes to a stroke, that urgency is incredibly real, and swift action can truly be a lifesaver. Yes, there is a very critical time limit for administering tPA medication, also known as tissue plasminogen activator, for an ischemic stroke. This clot-busting drug is most effective and safest when given within 3 to 4.5 hours of stroke symptom onset. The reason for this strict time window lies in how an ischemic stroke damages the brain and how tPA works. An ischemic stroke occurs when a blood clot blocks blood flow to part of the brain, causing brain cells to die from lack of oxygen and nutrients. tPA works by dissolving this clot, restoring blood flow. However, as time passes, more brain tissue becomes irreversibly damaged, and the risk of serious complications, especially bleeding in the brain, significantly increases when tPA is given too late. This balance between dissolving the clot and preventing bleeding is extremely delicate, making early treatment absolutely vital. Given this tight window, the most crucial thing you can do is to recognize stroke symptoms fast and call emergency services immediately. Do not try to drive yourself or a loved one to the hospital, and do not wait to see if symptoms improve. Emergency medical personnel are trained to identify stroke and can notify the hospital, preparing the stroke team for your arrival. Healthcare professionals often use the phrase, "time is brain," to emphasize that every minute lost means more brain cells die, leading to potentially more severe and lasting disability. Arriving at the hospital quickly not only increases the chances of receiving tPA within the optimal window but also allows for evaluation for other advanced clot removal procedures, which sometimes have slightly longer timeframes. These interventions can make a significant difference in a patient's outcome. So, by understanding the critical time limits for tPA and acting immediately if you suspect a stroke, you are taking the most powerful step towards preserving brain function and improving the chances of a much better recovery. Prompt action is truly the best defense against the devastating effects of a stroke.